Welcome back to my channel. Today's topic is micro needling. I have been doing that for about 10 years now, I think, just that procedure alone. I did the right thing, taking a class, learning how to do it properly. The class was provided by a plastic surgeon. It was extremely educational, even for me, knowing a lot about skin and about reactions of the skin as exposed to different procedures or devices. Microneedling is a procedure where sensory nerves, which are located in the papillary layer of the dermis, so the top layer of dermis, are annoyed by these needles that are used through a device and through a rotation motion as you are doing microneedling and you are rotating that device over the skin. The sensory nerves are going to wake up, especially Mercian sensory nerves. Those are the ones that react to anything that causes pain to our skin. Obviously, those nerves don't know that we are not hurting the skin, but what they do in return are waking up the immune system of our cells, and those are Langerhans cells. Langerhans cells are the first defense of our skin. The moment they wake up, they produce one substance which is called histamine. With that along, so the moment our skin starts producing histamines, we've noticed a change in color of our skin. So the skin becomes rosy pink, sometimes very red, depends on how much histamine we produce. And when that happened, I call it a local fever. What do we know when we get a fever, whether it's local like a pimple or general fever when we have a cold? Our body warms up. Well, when that happens within the skin layers, the secondary layer of the dermis, which is the reticulary layer, reacts to that warmth by producing collagen. Not only that, there is a function of our skin that reacts to the moment the skin warms up, and that's temperature regulation. So what happens, this function keeps the skin normal temperature. If it's too hot underneath due to production of histamines, temperature regulation function open the skin, open the pores, okay? So the heat can come out. Now, since you are doing microneedling, you are doing it over a mixture of different ingredients or compounds. So therefore, once the pores are open, because your skin produced histamine, the temperature got a little bit higher than normal, which led to pore opening. Those ingredients will enter the skin and will wind up in the bottom of the dermis layer, in the reticulary layer. And that's exactly where you want it. You most likely have heard microneedling produce collagen, but you have never probably understood how this collagen production takes place. Now you know. What I would recommend you, especially to professionals, I wouldn't recommend anyone to do microneedling on their own, on their skin at home. If you don't know how to regulate the deepness of those needles that are rubbing on your skin and the rotation of them, plus speed of those needles rotating on your skin, you may harm your skin quite significantly. So I recommend you to have this procedure done by a professional skincare specialist, whether it is a medical esthetician or a nurse or a doctor. Devices for estheticians are very simple. They are not to penetrate the skin deeper than 2 millimeters. Those for the doctors can go up to 5 or 7 millimeters. I am using a device that I can control and penetrates between 0.25 millimeter to maximum 2. There are very rare occasions when I use 2 millimeter setting because it's quite distressing for the skin. And I do believe our skin needs a push, not a slap. I prefer to offer this in a series of 6 treatments. You're going to say, why 6, not 4 or 5? Because everything I do is based on histology and physiology of the skin. There are 6 functions that are pretty much directing the way our skin behave and the way our skin look. Every single 2-3 weeks, a function, it kind of resetted itself with the right treatment, with the right ingredients. So what I recommend to my clients is to have a microneedling every 3 weeks as a series of 6. Would I continue with another series? Depends. If people have acne scarring or deep pigment, and I'm talking about the liver pigment, okay, like loasma or melasma, then yes, maybe I will do a second series. Either way, I would never perform microneedling alone. I always watch the skin, and there is more to it than just lack of collagen. If I notice there are some muscles issues where certain muscles start getting weaker, then after the microneedling, I follow up with either galvanic microcurrent or with thoracic current. And I do a passive electric exercise of the muscles. It's almost like I'm putting the muscles on a treadmill. You see them shaking as I place the electrodes on top of the nerves that penetrate to those muscles, and I obtain this a movement of the muscle. If there are uneven signs, uneven collagen, the skin looks like almost dully, like valleys and mountains, then I will definitely follow up after the passes with the microneedling. I would follow up with ultrasound. 5 megahertz is just enough for the skin. I do 20 minutes on top of a water-based formula. Ultrasound does not penetrate oils. And not only that, if you are using any oils in conjunction with ultrasound, you are going to burn melanocytes. And then 3 weeks later, you're going to see spots on the skin. So I try to use whatever is needed in order to achieve just not just collagen, production, but to take care of other conditions of the skin. If it's done right, it is a fantastic treatment. Can you do microneedling forever? No. Skin needs a break. And I have constantly talked to my clients because they get used to it. They like the side effects of it. They like the way the skin behave and looks. And they're like, I would like to do this nonstop. And I tell them, no. We've done this 1 or 2 series. Skin is a very lazy organ. One of the laziest one. If you keep feeding the skin with the same kind of procedures or products, the skin function starts slowing down. We don't want that. We want the skin to be alert at all times. So therefore, usually after 1 or 2 series, I continue the treatment addressing the very next important skin condition I've noticed as analyzing the skin with a different procedure. You can always come back to microneedling within a whole year. You can do 3 series if you want, but in between, you have to address the other issues. Collagen is not just one, okay? What are the ingredients I recommend to choose when you have microneedling done? Vitamin C is by far number one. We do not make collagen without vitamin C. We do not have pliability, flexibility of our fibers without vitamin C. Hyaluronic acid. In almost every video I make, I talk about this ingredient. It's a water-based ingredient, absolutely organic. It's extracted from the red comb of the rooster. You know, that little red gelatin shaking comb of the rooster. That's where the hyaluronic acid is extracted from. So it's organic. It is water-based, so therefore it makes it unstable in contact with heat, which to you should be this way, understanding this way. When you use hyaluronic, you have to combine it with an oil. So if I would have to make a mixture for my first pass, I usually do 2 passes of microneedling. It will be some enzymes. I have large options. Most of the time is bromelain extracted from pineapple. If I don't have bromelain, then I just have fresh squeezed pineapple juice, and I use that. I will definitely add into that an oil, like I said, as a buffer. I don't like the fact that pineapple is very acidic, and again, ideal skin is in between 5.5, 6.5. So you want to work with ingredients that will bring the pH of the skin to that, measurement. Then I would add some sort of acids. If someone has, give an example, pigment, it doesn't matter what kind of pigment it is. I use licorice root peel. It's readily available online. You can find it. How much I put into that? Probably to a teaspoon of oil and a teaspoon of hyaluronic acid. I put about 25 drops of the peel. Then I would add vitamin C, as I told you, and that will be about 20 drops of vitamin C, either ascorbic acid, which is liquid, so it's easy to achieve that into your formula, or I would squeeze lemon into that. Another absolute favorite ingredient that I select to do my first pass is DMSO. DMSO is an ingredient that is absolutely phenomenal. I urge you to read about DMSO and find out many benefits from this ingredient. In skin mixtures, becomes an ingredient that is helping better and faster penetration. The moment you put it in the skin, in addition to other ingredients, it's a carrier of those ingredients deep down inside skin where it's actually needed. How much DMSO I will put to the formula I told you is about 10 drops, 99%. You find it online and you can use it. As I told you, don't use it straight on the face. The combination of any peel, like I said, you have in this formula licorice peel, okay, and DMSO, it will give the client some itchy kind of sensations, and they might turn like a hot pink color, but that's okay. As soon as you've done with the first step, tone the skin. Use a toner. I make my own products. One day I'm gonna show you how to make a toner. It's very simple. And then after I tone the skin, I follow up with the second pass. Second pass will have pretty much a bunch of vitamins. I use vitamin E, vitamin D, vitamin E, vitamin C, vitamin K. Vitamin A, it's a cell renewal vitamin. So it helps the skin to produce new healthy cells and rejuvenate the skin, meaning push the old skin up to the surface. The moment they reach the top layer of our skin, before they die, they are actually producing another cell, okay? So once you have that, you keep your skin younger. You have to be careful with that because retin-A is vitamin A in a very high dosage. It's not recommended to be used forever or in concentration higher than 0.5. That will be okay. Anything above that, you're going to have a peel from that. And you don't want to do too many peels because you get rid not only of the dead cells or dead tissue, but you get rid of the cells that didn't have time to divide. So you are aging your own skin if you continue using vitamin A derivatives like retinol, Renova, retinoids nonstop. You're gonna age your skin in time. Or you're gonna see what I see when people are abusing vitamin A or pills. I call them plastic. They look like this. They're very tight and abnormal looking because of the large amount of vitamin A they keep using for years and years. Vitamin D, it's an immune system vitamin. As zinc oxide or zinc is an immune system mineral. So I add vitamin D for that purpose. Vitamin K, it's a capillary corrector vitamin. Okay, it helps the capillaries to fill in the gaps where the capillaries open up or broken, and then you see those red veins all over your face. So we will help in the correction of the capillaries. Vitamin C is the collagen making vitamins. So those will be added in my second pass formula. Hyaluronic again, this time will be a little bit larger amount, about 2 teaspoons. I will add into that 1 teaspoon of aloe vera because it kind of binds into the vitamins and control the temperature of the skin. And I definitely add just 1 drop of either diaper rash cream because of the zinc. I'm looking for the zinc. Or if you have zinc oxide powder, you put a tip of a teaspoon into this mixture. With that comes certain essential oils. So I'm looking for essential oils that contain vitamin C, and that will be bergamot, lime, lemon, orange, nectarine, tangerine. So I use one of these oils, don't have to use them all. Definitely I'm adding lavender because again, it's a temperature regulating essential oil. And I need to keep the histamines down at this point. Once this mixture is done, I lay it on the skin with a brush and I start doing my second pass of microneedling. The moment I finished, most of the time I follow up with the gua sha massage or with lymph drainage massage. I don't do just plain simple massage because I'm very careful with the massage. The more you massage the skin or the stronger you massage the skin, the more collagen you move, and you don't want that. If you look at the collagen on the microscope, it looks like aloe vera consistency. It moves easily. Then after this lymphatic drainage massage is done, and I make sure that whatever I use, it's already inside skin, I am following with a mask. Every single time my clients come, receive a different mask. This time because it's all about collagen and it's about calming, and I also want to neutralize the acids and the MSO, I follow up with a potato starch mask. So you can buy potato starch online. About a teaspoon of that. I mix it with aloe vera and some seaweeds. If you don't have any, you definitely can find, and it's very inexpensive, spirulina, the blue-green algae. I use about half teaspoon of that. Again, follow up with a calming, soothing essential oil, okay? Either I'm using frankincense, I'm using lavender. Those are the ones that I use at the end of the treatment. Sometimes turmeric oil, yes, I know it's expensive. A tiny bitty bottle, it's close to $40, especially doTERRA. I use only doTERRA essential oils, and they are nowhere being inexpensive. After that, I lay over the mask. The most important thing I recommend you, whether you do a mask at home or in a skincare establishment, you want to make sure that you follow up with mommy mask compresses, which could be just gauze that is moistened. I usually moisten everything in tea. I make different teas for different masks, okay? One of my favorite one is juniper tree buds. I make a tea out of that, and then I soak my compresses. Again, could be gauze or could be baby wipes, okay? I soak them in this tea, and then I lay them over the face like a mommy mask structure, and follow up with 2 different lights. First, if the client has oily skin, I do 10 minutes blue light, because it's the light that implodes surface bacteria. It's the light that will fight bacteria development and regulates the function of the sebaceous glands. Then after that, I follow up 15 minutes with the red light. Red light, it's the light that produces hyaluronic acid. So the moisture inside of our skin is the pain light. So every time you have a pain everywhere in your body, if you have a device with red light and you put it on that area for 20 minutes, it will take your pain away, because it's relaxing the nerves. The moment the nerves are relaxed, the pain is gone, okay? It is also the sleeping light. Every single time I use red light, I do not cover the eyes with glasses like those tanning glasses. I just put tea bags over, and I tell my clients, you might see some light. It's not a laser light. It's not going to affect your cornea or your retina. And I guarantee you, as strong as this light might feel, within 5 minutes, you're gonna be asleep. And sure enough, they are. When the mask is removed, I will just follow up with my daytime lotion. As I mentioned in previous videos, I can make everything. And I do for my clients. I make products they can take home. In my office, the day cream, it's actually a mixture between zinc oxide, type of rash, oil, hyaluronic, and dimethicone silicone. So I put that over and I send them their way. And that's how a proper microneedling, in my books at least. I'm not saying there are other options there, but that's the way I do it. I've tried many versions until I came up with this protocol, and it works wonder. I hope you will go to see a professional to have microneedling done professionally, and I hope you're gonna love it as much as I do. Any questions you have, make them in the comments. Thank you.